হ্যালো দেখতে পাচ্ছ? হ্যালো 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 রকি, হ্যালো হ্যালো,
Yes, sir.
স্ক্রিন দেখতে পাচ্ছিলে? শেয়ার করছিলাম যেটা।
Yes, sir.
ওকে ওকে, চলো। Today we discuss about the different topics. Parenterals, I think these are the topics, not only the microbiology but also covered with the different subjects, and how to preparation of parenterals, and what are the preparation and what are the formulation regarding the different subject wise, how to correlation between the different subject. The the parenteral preparation, basically parenteral means parenteral. Parenteral preparation, that means those preparation which are used by the other than the oral route, and it is prepared. How it will be prepared? Not how to manufacture on the parenteral preparation, and what are the precautions, and how it will be sterilized, especially the different subjects or a preparation of this formulation and help for the different subject, and how to correlate between these different subject, and today discuss it at that manner. So please carefully listen it. First of all, the introduction, route of administration, general requirements, pre-formulation, adjustment of the tonicity method, sterilization, formulation for the parenteral, packaging, evaluation, and parenteral. That means introduction, the route of administration, this is the pharmacology, general requirements, this is the ceutics parts or condition, pre-formulation, obviously the pharmaceutics, and adjustment of the tonicity, that means the biochemistry, and the sterilization, the microbiology, and the formulation of parenterals, that is another, also ceutics and packaging and evaluation, that means the quality control, that means analysis, as well as the pharmaceutical part. So today we discuss about the different subjects in one topic. Okay, different subjects in by one topic. I think you agree with this. Hello, no problem. হ্যালো, ওর এ তো সারাদিন আসতে থাকবে আর ঝামেলার শেষ নেই। 5 মিনিট, কোনো প্রবলেম নেই তো? হ্যালো,
No, sir.
একটা টপিক, এটা সিঙ্গেল টপিক, বাট হাউ টু কোরিলেট বিটুইন দ্য ডিফারেন্ট সাবজেক্টস, দিস ইজ মাই অবজেক্ট। তাই তো আমরা এতক্ষণ মাইক্রোবায়োলজি পড়াচ্ছিলাম, যেহেতু আমাদের কিছুটা কমপ্লিট হয়েছে গেছে, সেই জন্য আমি আই ক্যান আন্ডারস্ট্যান্ড, এবং এইভাবে যদি পড়াশোনা করো যে কোনো টপিকে, তাহলে ইউ ক্যান মানে তোমার যে ফার্মাসিস্ট হিসেবে ডেভেলপ করতে খুব বেশি দিন সময় লাগবে না। আমি একটা জাস্ট গিভ সাম এক্সাম্পল হাউ টু স্টাডি অ্যান্ড হোয়াট আর দিস টাইপ অফ স্টাডি। ওকে, আর নেক্সট যাদের আছে আমি আর অ্যালাউ করছি না। ওকে, নাও উই ক্যান স্টার্ট, অলরেডি টাইম ইজ ওভার। So first of all, the introduction, that means parenteral preparation. All of you know the parenteral means those preparation which are applied other than oral route. That means beyond the oral route, those type of preparation, either injection, irrigation, ophthalmic, these are all are parenteral preparation. Generally, and where it will be applied, and there is some advantage and disadvantage, and time there in the timing I am discuss with you. First, the term the parenterals derived from the Greek one para means the besides, and enterals means the intestine or other than the intestinal. That means to avoid the oral routes, other routes are all are parenteral routes. These are all parenteral, and what are the criteria, and thus the parenteral administration should included the administration of the drug by any route other than the intestine, that means oral route. Parenteral products are considered those sterile drugs, solution, emulsion, or suspension. That means parenteral preparation not only the solution, it must other also emulsion, suspension, or other types of dosage form can be used by the parenteral route. Parenterals are the sterile preparation must be. In case of oral, there is no need of sterility or sterile. But parenterals are the sterile preparation intended for the administration under or through one or more layer of skin or mucous membrane. In this case, that will be penetrate or administered under the skin or mucous membrane. What is the advantage of the parenteral preparation? The parenterals administration are the generally used for the unconscious patient. Those are not swallow, not taken by the orally, and who cannot take oral administration. And they are free from pyrogen. They were because these products are free from pyrogens and low toxicity as compared to solid dosage form in case of parenteral preparation. And in another advantage is the 100% bioavailability. What is bioavailability? The rate and extent of the drug absorption here is the 100%, because direct either 500 milligram tablet, you take 500 milligram tablet by tablet paracetamol, dharo paracetamol 500 milligram tablet you take by orally, their 100% cannot be bioavailable. That means what is the bioavailability? That means after the absorption there goes to the blood circulation. This is called the bioavailability. Rate and extent of drug absorption is called the bioavailability. That means when you take the drugs after this, if there are 500 milligram and half after the administration of 500 milligram, then it goes to the circulation 500 milligram. That means 100% bioavailability. But in our body there is some barrier and there is some metabolism. That's why the 100% drug cannot be reach into the bloodstream. So that is so in case of oral dosage form, no 100% bioavailability. But in case of you administered in the parenteral route, there is 100% bioavailability, because it's the whole the drug administered directly into the bloods. No change or missing or dose. Another, but there is some disadvantage also. Requirement of the specific technique is aseptic technique. In case of parenteral preparation, last class we discussed about the what are the aseptic technique. In case of oral preparation, there is no need of aseptic technique, but in case of parenteral preparation, that must be aseptic technique is production, compounding, and handling of the products. So aseptic technique. So extra cost will be afforded for this aseptic technique, and it must be maintained. And requirements of the trained personnel for administration. If the oral dosage form, you need not any other person. The patient or anybody from homemade, you can easily administer, not need of any other person. But in case of parenteral, not only the other person, also the skilled person is required. Real or psychological plan associated with the injection, there is a real and psychological play there is but when you take the tablet or capsule, there is no psychological problem, and highly risks if any mistake happen at any points. When you administer, suppose you cannot remove the ear, there is a chance of air embolism and patient can be dying. Another is it will be administered in intramuscular or intravenous, there is a problem. So it is given to intravenous or not, so there is some risks. But in case of oral, there is no risk and high cost as compared to the solid dosage form, because the aseptic and others parameter can check it. That's why their cost will be the high. So these are the basic disadvantage of the parenteral preparation. Next, what are the route of administration? I discussed just one thing. Route of administration. In case of parenteral, in case of oral, there is oral route. But in case of parenteral, so many routes. Number one, intravenous. the drug must be introduced into the vein. Intramuscular, that means just into the muscles, and subcutaneous, this is the another route, just not in the intramuscular, not in the muscle, but above the muscle, and in the intradermal, just below the dermis or below the skin. So there is a, you can know thorough knowledge about the layer of the skin. Otherwise, you cannot administer if it is intradermal, where it will be pushed, and where it will be subcutaneous, where it will be pushed, and intramuscular. I mean, actually, intradermal just dermis layer, and subcutaneous just below the dermis, and above the deep muscular, that is the muscular intramuscular. Then the vein, it is very difficult, and it is a very skilled person is required for intravenous and other routes. These are the route of administration of parenterals. So we can see it, what is the structure of the skin. What is the structure of the skin? There is a dermis, first is the epidermis, then the dermis layer, and the intradermal layer, intramuscular layer, intra-arterial, intravenous, and subcutaneous route. So these are the layers. You can see it by 3D diagram. The epidermis, the hair follicles, and the upper layer, this is the epidermis and the dermis. Especially the intradermal, there here it will be injected. But it is this thickness of the skin layer is depend on the varies person to person. So be careful which person, if it is a fatty person or a thin person, in that case their layer skin will be, you can assume it, or you can skill. That's why the skill labor is required. So skill person is required for administration, especially for the intravenous, because you must be injected inside the vein, not extravenous. Sometimes vein will be punctured. After that, so how it will be happened? You inject your needles and draw the piston, then blood will become, then you confirm J, it will be inject into the intravenous route, intravenous or in the vein. Okay, so in that side, so their skin structure must be know it, otherwise you cannot be possible to administer in this route. Intramuscular route. First of all, generally most of the parenteral preparation are used in the intramuscular injection and given by the upper and outer portion of the gluteus maximum. Gluteus maximum in case of the arms, and in case of children, some adults, and intramuscular route given in the deltoid muscle, which are in the shoulder. The gluteus maximum, and another is the deltoid maxima. And this typical needle is the, maybe remember it, this gauge 20 to 25 gauge, 1.5 to 1 inches needle. The length of the needle is 1 into 1 inch needle, but the gauge is the 20 to 25. We remember it. This question is come in the different examination. What are the needle for the intramuscular route? 22 to 25, and by injection there is administered of 90 degree, just 90 degree, and volume administration less than 2 ml. This all parameter is very common, which will come in the examination. In case of intramuscular, which how many mLs? Less than 2 ml. Degree 90 degree, and gauge needle typically 22 to 25. Then the intravenous injection, another is the intravenous, the fast acting route because of the drug directly into the bloodstream. This is the first, and in case of emergency patients, the intravenous route. So that's why there is some doctors or nursing staff have there's a channel, and from this channel administer the drug directly. There is no need of required any times for absorption directly into the bloodstream. So intravenous route is the for emergency purpose and often used for the emergency dependent and critical care, and for the fluid and electrolytes, and to provide the nutrition to be patient. And it critically intravenous injection are administered 15 to 20 degree angle. In case of venous, no 90 degree, because in the, if you administer 90 degree, it will be puncture the vein, it will be pushed just then cross the next layer. So there is a problem. That's why just you push in the 15 to 20 degrees, and then needle will be up and the blood will become, then you can confirm it will be just inject into the intravenous. Then you push the piston for administer the drugs, and volume MTT minimum quantity at least 1 liter. In case of intravenous, but sometimes minimum, because sometimes 1 ampoule, 1 ml ampoule also given in the intravenous route. Subcutaneous, administer medication below the skin into the subcutaneous fat, often the longer onset of action and a longer duration of action compared to the IM and IV, and given in the 45-degree angles and give the 25 to 26 gauge needle and a 2 inches length, and 1 ml must be generally used subcutaneous route insulin. Write down this: insulin is the more used for the subcutaneous route insulin. Next is the intracardiac injection. Sometimes to increase the cardiac tonicity or cardiac rate, cardiac rate or heart rate. In that case, directly inject into the cardiac or heart. But how it will be injected? There is some given some needles, and this given the heart muscle or ventricle at the time of the emergency only, or sometimes the operation. The intracardiac injection will be, and another is the intrathecal. There is given in the subarachnoid space of the spinal cord, generally in the general anesthetic or local anesthetic in case of child labor, or in the case of operation generally in this route. Thus it just introduced into the spinal cord or subarachnoid space of the spinal cord. So be careful, be sincere, be serious in that case where it will be administered, where the subarachnoid space of the spinal cord, and wherein it is injected very hard to inject. So this route is very tough. This route is used for the spinal anesthesia. Next is the peridural injection. They are given in the below the dura mater and inside in the vertebra, and used for given the spinal anesthesia. Another is the intra-articular injection. There is given into the articular ends of the bones in the joints. There is a lubricating agent intra, and intracerebral. There is a given in the cerebrum also. That means brain. It is huge. I just discussed the upper portion because the another is the intra-articular. The lubricant, sometimes the fluids or knee joints, the fluidity is less in that case, or sometimes the swelling of the knee joints. At that time, generally intra-articular injection will be generally high cortisone, and the hydrocortisone injection will be introduced into the joints of the knee, and there is a very good effective good action of by this route. You cannot in this case you apply by intravenous or intramuscular. There is no action, but it directly into the joints, or it is called the intra-articular injection. So general requirements, these are the preparation where it will be administered and the route of administration. But which type of solution is administered? One is the vehicles. General requirements, you prepare some formulation, some vehicles. Last class we discussed about the vehicles. Generally the water is the main solvent, or sometimes the oil injection also administered. Oil is the vehicles. So how to and which type of water used? Last class I discussed about the what type of water can used for this for this particular formulation. I discussed elaborately. So that's why that is called the vehicles or the solvent. Another is the tonicity. Last class I discussed about the tonicity. First choice of the vehicles, then the drug solution, then control the tonicity by the freezing point depression method and any other 3 methods. Another is the additives. Not only the vehicles, not only the tonicity, another is the additives. Which additives for which preparation? Or in case of parenteral, if it prepare intravenous, which additives? In case of intramuscular, it is which additives? And the container and emulsifying agent. Obviously, the drug must be storage is very important parameters as a pharmacist. The where it will be stored, which type of container is used for this particular formulation, and along with sometimes the emulsion, oil emulsion also injected. So what type of emulsifying agent, cationic, anionic or non-anionic, which type of, this is very very important. And from this knowledge you can design a particular formulation, then you can administer it. So these are the 4 categorically 4 types of parameter you can prepare, check and compromise and finally optimize it, and then you prepare a formulation, after that administered by the parenteral routes. First one is the vehicle. Which type of vehicle used for this formulation? The water for injection, in case of especially for the parenteral preparation, water for injection in the vehicle for the first choice, obviously, because there is no bacterial contamination or pyrogen. It should be free from ions and the carbohydrates. No bacterial contamination. Last class we do bacteriostatic water for the injection in the sterile water for injection. contain one or more bacteriostatic agents. Last class of the benzyl chloride, which are used as a bacteriostatic agents, and sometimes the co-solvent are used. Not only the water but other solvent is used for this preparation. Water per injection 100% V by V volume parenteral use, and water miscible to co-solvent including the ethyl alcohol, actually ethyl alcohol, some mistake, ethyl alcohol, glycerin or propylene glycol and propylene. Generally the alcohol, ethyl alcohol is used for the co-solvent. Sometimes the drugs molecule which are not soluble in water but sometimes co-solvent along with the some percentage of alcohol, there will be better solubility. So in that case the vehicle can be chosen. Then the vehicles, in addition, the solute should be free from the microbial contamination using the additives and the various types. Various types are the coloring agents, sweetening agent, preservatives and others are property. Another is a very common is the very stabilizer. Another is most important additives is the stabilizer. When the drug is prepared, at that time it is not used, which are used after or 1 month, 2 months or 1 year, 2 years. That is the life period. So in that case, there is no degradation of the product. How to stabilize that? There is some formulation accelerated stability system study. So it is another parameter, how it will be sterilized for the longer period of time. Stabilizer enhance the stability of the drugs compared in the preparation, such as chelating agents or other type agents. Sometimes sodium chloride also is a stabilizing agent actually, or antioxidant which are used as a stabilizing agent. And the wetting, suspending agent, emulsifying agents, wetting agent to maintain the particle size and the twin 80 or span 80, twin 80, 40, 60 sorbitol, tiorsate, or so these are the suspending agent as well as the some emulsifying agent or wetting agent for solubility, to enhance the solubility of the particular drug. Sometimes the emulsion or suspending agents, the acacia or gelatin. So which preparation and what type of emulsifying agent, wetting agent is used, that will be optimized first, then you can apply it. And this physicochemical parameter must be checked, otherwise it will be a great problem after injection. Then the buffering agent formulation must be maintained in the pH and acetone citrate and phosphate buffer. Generally the phosphate buffer is used, or citrate or acetone buffer, because to maintain the pH. Suppose you administer in the skin or for the local action, at the local action their pH must be maintained, or some drugs having some different pH, so that pH must be maintained and it will be constant pH by the buffering agent. And another is the antioxidant. The oxygen sensitive drugs are maybe avoid the oxidative degradation, and sodium bisulfite and formaldehyde, acetone and thiourea and EDTA. Antimicrobial agents, sometimes some antimicrobial to prevent the microbial growth, or packaging, the phenol and chlorambutyl use. So these are the additives, and which additives and which I did not discuss. Just these are the general method you can consider before the formulation development. Another is the tonicity contributor. Last class I discussed about the sodium chloride or borax, which are used as or determination of the freezing point of the solution, and parenteral solution are required for the isotonic with the blood plasma, blood serum or other the body fluids. Not only the blood plasma, when you administer the others, the CSF, cerebrospinal fluid, at that where the blood plasma concentration, at that time you consider the tonicity. So you can tonicity contribute by this methodology, but sodium chloride and borax, which are usually a tonicity contributor, and which work where it will be applied in the blood or the other blood fluid, depend upon this you can determine the tonicity, and by this freezing point depression method, I think you know it. Next, the container and the closure. This is another most important. Suppose you are preparing 100% good quality of the product, but due to improper storage, due to improper container or closure, there is some interaction between this closure and container with the drugs, their formulation will be degraded, or their stability problem will become. So which formulation or which product suitable for the which container and the closure, that must be studied. Otherwise you can prepare a good product but it will be destroyed just due to the container and the closure. So any container of parenteral product should be maintain the integrity of the product, and sterile must be, obviously the container must be sterile and the pyrogen free. Otherwise your product is pyrogen free and sterile, but the container is not sterile or pyrogen free, so in that case they are immediately contaminated, and should be attractive, obviously another most important criteria, and should not react with the product glass, plastic, rubber material, and type 1 glass 1, type 1, type 2, type 3, and plastic used for the polyethylene. The large volume preparation is dispensed by the polyethylene and polypropylene and plastic and rubbers. Okay. The pre-formulation. What is the pre-formulation? Now, before the formulation, there is some criteria, there is some procedure or some physicochemical parameter check it before the formulation. That is called the pre-formulation study. In case of Ceutics, the pre-formulation, it involves the determination of both the physical and the chemical property of drug with the goal of a new drugs with a safe, stable, and efficacious. This is the main criteria to prepare a new product for safe, stable, and efficacious. But before a preparation of stable and efficacious, it must be their physical and chemical property. Otherwise, you cannot be formation stability. Suppose you add some acid with alcohol base, there is a problem. So in that case, the establishment the physicochemical property of a new moiety and determine the kinetic coefficient, kinetic property, the first order, zero order, which type of it will be there, and pre-formulation study various type like physicochemical property of a new drugs. After the preparation of the product, they are physicochemical obviously study. Then the stability study, how much time or how many years it will be stable. That will be another mechanism, the drug degradation. What are the type of drug degradation, how it will be degraded, and what are the T-hub or biological T-hub, and test for the packaging material. Obviously, before which material is incorporated, stored in the which product, that will be tested. Otherwise, you did not know the which, suppose you just kept into the one drug solution into the packaging material, the drug will be lost. So before it will be kept into the container, it will be studied that which drugs are kept in the which containers is suitable. So that is called the pre-formulation study. Basically, these are the 4 parameters you can check it for the pre-formulation study. One is the stability testing. I think another the physicochemical property of the drugs, new drugs, mechanism of drug degradation. After the formulation, then the drug will be degraded day by day. So it's a hot time will be time taken in case of, and if it is the 50% drug loss or intensity or potency is the loss, that is called the time required for the, that is called the T-hub, or the time is required, the 50% potency will be lost, or the 50% potency, that is called the T-hub. And the expiry date generally in the 90% drug will potency will be lost, that is called the expiry date from the manufacturing to, if the 100%, then it is 90%, that time is required, it is called the expiry time or expiry date on the manufacturing. And test for the packaging material, obviously the drug product where it will be placed, this material, packaging material must be know it, otherwise it will be a serious problem. Next is the molecular structure and the weight. The first and the most important step is the pre-formulation. First is the molecular, which molecule and which type of chemical reaction occurred, and the structure and the molecular weight, and the color, appearance of the color is the indicative, and the physicochemical instability, which have the decreased shelf life of the product. Thermal analysis, the drug may be undergo the physical and chemical changes due to the variation of the temperature, and which have been associated with the loss and gain. And this changes analysis, this thermal analysis, that means the kinetic. Solubility, another most important factor, the soluble drug is soluble or not. If the drug is insoluble, there is no need of administer. If the clear solution of the injectable that are to be administered either infusion or via route of administration depend upon the solubility, and solubility of the substances determined by the spectrophotometric method or by the pH profile, if it's soluble or not. Non-aqueous solvent like ethyl alcohol, glycerin, propylene, glycerol, and partition coefficient, it is used to determine the rate and extent of drug absorption. This is another most important one. After the drug will be administered, but it will be partition, that means it is enter into the cell or not, that is by the partition coefficient, and they are explained by the equation P by P C0 by C0, initial concentration of the drug and initial concentration of water. and the oil water partition coefficient and light stability. Drug solution tests for the stability. Drug solution placed into the pet petilate and the glass ampoules respectively, and the drug absorb placed in the light resistant container. And so many different types of glass amber colored before for light photosensitive drugs and the carborax which are used for the control. And the sample are placed and maintained in the lightening the conditions such as 500 foot candles of period of 2 weeks. So these are the some different stability testing method by the light stability, because light sometimes degraded the products also. The mechanism of the drug action by the mechanism of drug degradation. Generally drug are degraded by the different methodologies. First one is the hydrolysis. This is the major cause of hydrolysis. By this method the drug will be degraded, or then oxidation, then reduction, and then decarboxylation, and then methylation, acetylation, so many processes. But generally these are the methodology which are considered the where the drug will be metabolized. It is the most common reaction which is responsible for the degradation of the drug. As for example, sodium phenobarbital, which are used as a hypnotic drugs, but on presence of water it will be degraded. Oxidation may leads to decolorization of a parenteral preparation like ascorbic acid, ethanol injection. And this reaction, decarboxylation, the reaction commonly used for the common compound of decarboxylic acid or functional. This is the groups. Testing for the packaging compounds, sometimes the glass, powder glass test. Just you can remember it, but this is the procedure. What is powder glass test? Before, when you kept into the glass, then this test must be done. In case of glass, powder glass test and water attack test. Two tests is done in case of glass, but I not discuss in this. You just remember it, what type of procedure, what type of test done before the container can be choose. Powder glass test, water attack test. In case of plastic, leakage test, collapsibility test, clarity test of the aqueous, and transparency. In case of rubber, penetrability, fragmentability, self stability test, and extraction test, destructive test. These are the different types of tests, and you can go through the internet what are the tests, but you remember it, at least you remember it, what type of test taken for this particular material. Adjustment of the tonicity method. Tonicity method by the initial equivalent last class discussed the white vehicle method, Finn's method, molecular weight concentration, and psychotropic method. These are the four methods. Basically, the freezing point depression method is applied. Precautions for the aseptic work. I think it will be discussed elaborately in the aseptic technique. The preparation must be, the parenteral paper must be prepared in the aseptic condition, because to prevent the contamination of the product as well as the free from microorganisms, not only microorganisms but also their metabolic products like spirogens, and microbial contamination or the possible non-touch technique should be used, and air distributors be maintained. Only the trained person should be perform aseptic work, and where the container contamination is detected, the source should be removed. So the aseptic condition, I think, did not details about the and filling and sealing. How to filling? The solution is sterilized by the filtration. Sometimes the filter, membrane filter is used for under the aseptic condition. Filling consists of the quality of the product and ensuring the precision, and moderate lysis and autolysis high seed filling machine for container part times. Next, sealing. After the preparation of the filling, preparation of the formulation, then fill with the container, then after that sealing, otherwise it will be contaminated. So prevent the contamination, vials and the bottles are sealed by the close and open with the closures, and variety of the automatically sealing devices available in the market that are available today and that are seal the container. Next, the sterilization. Parenteral preparation must be sterile. And what are the sterilization method? I discussed it already. This is my first class of this microbiology. Sterilization, heat sterilization, filtration sterilization, radiation sterilization, gaseous sterilization, moisture. Here there's so many sterilization. All these sterilization I discussed with elaborately. So did not discuss in their time. And but you remember it, which material sterilized by the which method. you can just apply on this particular method. Suppose glass apparatus or the oily solution which is sterilized by the dry heat sterilization, and the parenteral bandages which are sterilized by the moist sterilization. So just you know that which material sterilized by the which method, then you can apply this method. Sterilization, moist sterilization, and the bacteriological indicators indication the spores bacilli and spores bacilli, dry heat spores of the bacillus pumilus, and ionization radiation bacillus pumilus, I think already discussed, and gaseous sterilization bacillus subtilis, filtration Sarsia, Marcian species, and the spores of the, these are all I discuss indicators, so many biological indicators, and the parenteral preparation area, that must be compounded area, aseptic area, and quarantine area, and storage and the transport, and the packaging and labeling and cleaning up area, sterilization. These are the area you can design it. Total 6 zone, and the stock room, and here is the storage and transport room. These are the basic concept for the preparation of parenteral. Then the production of the parenterals. Production of the parenteral, there are the various types of parenteral preparation. Time. Start your list. Hello? Hello?
Yes,
So
sir.
another 30 slides left to continue my class, or your time is over. So what happened? কি করব এখন at that time? Hello?